Well, tonight, new research points to an increase in autism diagnoses rates in U.S. children. Health Secretary Robert F. Kennedy Jr. calling it an epidemic and promising answers.
As Stephanie Stahl shows us, the data adds to a growing pile of debate over what might be causing it.
The report from the Centers for Disease Control found that in 2022, 1 in 31 children were diagnosed with autism by the age of 8. That compares to 1 in 36 2 years earlier. The U.S. Health Secretary described the rates as shocking.
There's an extreme risk for boys. Overall, the risk for boys of getting an autism diagnosis in this country is now 1 in 20.
At a press conference Wednesday, Robert F. Kennedy Jr. called autism a preventable disease and said environmental toxins are the cause.
These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old.
He rejected the theory that rising rates are due to better diagnosis, calling it an ideology of epidemic denial. But an author on the CDC study says increased awareness is a factor.
We've changed diagnostic practices, we've changed diagnostic criteria, we've broadened what we think of in terms of the autism spectrum. And also, we've gotten much better at conducting these prevalence studies themselves.
Kat and Dan West have 4 children, 3 of them with autism. They say the health secretary's approach will make things worse.
Autism is not an epidemic. It's not a disease. It is a developmental condition. The way you treat it is through support and therapies and treatments. Not by saying, let's find the cause.
The current autism rates are nearly 5 times higher than in 2000. West says early intervention has been critical for getting the best support for his kids. Stephanie Stahl, CBS News, Philadelphia.